Hi there. So I'm just going to show you how medication information that has literally been updated within the same day, how it will immediately be presented to any visiting care staff members who are going there after the update. So if you've watched the video before, then what we did is we received some medication information for Frederick Thompson, that he had new medications on his T-call. So this information has literally just been pulled through approximately 5 minutes ago. So we know that our that Frederick now has the updated medication delivery at home, and our staff have got the information to show what they're supporting with when they get there for tea. So let's just log in. So here's my staff member logging in on the device at home. We've done it on this T call, so we'll log into that as an example. So let me just pop my unique ping number in. Okay, so we can see that the T-call has now been logged into. So it's gone to in progress. So let's just have a look at the logbook. So these are the tasks that we already knew were there. I'll just quickly mark these off. There we go, that's all looking good. And fantastic, the new medication's on here now as well. So I can show that we've supported with some paracetamol today, so that was required. The pain patch, we've put the new pain patch on. And there's the E45 cream as well. And if I just tap on here, we can even see the body map as well. So we've got a good visual for where that cream is supposed to go on the legs. Legs aren't looking too bad today, so we'll just add a little comment. So legs not dry today, so it was not required. And then let's just pop a little note here. Submit that. There we go, that's all done. So I can just complete that now. You'll notice the call's completed on here as well. So the people back in the office, they can literally immediately see that these notes have been put in, and they can see the new medication that's been assisted with as well. If we go to the audit log, just have a look at today's calls. Let's just have a look. There we go, the T-call's been completed. So I could literally audit this in real time now and see all of this data on here immediately. So there you go, it just goes to show that you can literally, within 5 minutes of receiving medication data, you could have it in the system, and the staff member visiting that day will also have it immediately in front of them as well. So thank you for watching.